What is Premier Doug Ford saying about this? Why he thinks this plan makes sense for Ontario?
I think part of it is the fact that he acknowledges that many people are just waiting far too long for surgeries, for diagnostic tests. And so something's got to give. You know, we've heard him repeat over and over for months, really, that the current situation, the status quo, is not working. So he talks about this, think of it like a dam, that this wave of surgeries, requests for surgeries, is putting too much pressure on that dam and it's going to break. So he talks about rerouting the water, in this case, rerouting some of those patients from hospitals where they're waiting to have procedures instead into those private clinics.
He says this is going to be permanent, correct? This is not a temporary fix, Siobhan, to the backlog?
That's correct. I mean, we definitely have seen this backlog grow in large part because of the pandemic, because surgeries were canceled or postponed to maintain capacity in our hospitals. So this is not a short-term thing to clear the backlog and then we go back to the way things were before. This will be a permanent change. You talk about the cataract surgeries that are being added at 4 clinics in Kitchener-Waterloo, Windsor, the Ottawa area. Those will be 14,000 more cataract surgeries, not just this year, but every year going forward.
This obviously triggering a fierce debate as soon as we talk about the idea of private clinics and how they work within the public system. For people who are waiting, Siobhan, we talked about 200,000 people in Ontario alone. For some of them, this is going to be some good news, but I'm curious what critics are saying here.
Critics do have some concerns about what protections or what lack of protections there are in this plan for upselling. If you are waiting for a cataract surgery, for example, there's fear that for-profit clinics in particular, which may have incentive to raise more money, to get more money out of the patients, that they may try and upsell patients and maybe not really highlight the options that are covered by OHIP. The health minister, all she really said about this is that if people feel like they were treated unfairly, they can complain to the ministry will investigate. But by that point, really, it's too late. And that's really leaving a lot of onus up to the patient to really know what they're entitled to, what is covered by OHIP in the first place. And it's hard, I think, to disregard the opinion of a doctor when they tell you there's a better, brighter option.
Yeah, what about staffing levels, too? I know there's some concern about what it might do, that it might pull people out of the public system.
There's a big concern there, and I think that was something that many people in the medical profession had been hearing, to hear what the government's answer was going to be for how they were going to address that. And I think many people are finding the answer from the government a little lacking today. Minister Sylvia Jones really said that as clinics apply to perform more surgeries, they're going to have to present to the government their plan for getting the staff to make those surgeries happen, whether they're going to have their existing staff work longer hours, different shifts, if they're going to have to hire. But there's nothing really saying if a clinic says that they have to hire from the outside, if the government's confident that they won't be pulled away from the hospital. She does say that it's important that hospitals be protected to maintain the staffing there, because that staff is needed for the more serious surgeries that are going to continue in hospitals. But she didn't say if that meant that the government would turn down applications from clinics that said they would have to hire from the outside.
No doubt other provinces are going to be watching very closely, because we know that there are backlogs right across the country. Can you give us a timeline, Siobhan, when this program is going to start rolling out?
This really happens in phases. So the first phase is really focusing on the cataract surgery because it's such a large proportion of the backlog surgeries. So we'll start to see those 14,000 extra surgeries added by March. After that, we'll start to see a series of other surgeries added right across the province. So that'll be later this spring, following through the summer. And by next year, we'll see even more surgeries added, and also more clinics have greater ability for CT scans and other diagnostic tests.
Siobhan Morris in Toronto. Thank you, Siobhan, for this great stuff.